Nigeria was already neck-deep in a war that had been prosecuted for the better part of 10 years in her northeastern parts before the arrival of coronavirus on her shores. The pandemic had been slow in reaching those parts, but now that it's there and spreading fast, there is growing apprehension that something needs to be urgently done to protect, especially the welfare of thousands of internally displaced persons who are embedded in camps scattered in different parts of the region. What should be the expected role of the Nigerian stakeholders in this respect, with COVID-19 adding to their initial fears of Boko Haram terrorists? How much confidence do aid workers who have been defying the odds to cater for the IDPs have in further staking lives and limbs? We are now going to talk about this with Dr. Ndu Nwokolo, a conflict resolution and humanitarian affairs expert. Good morning, Dr. Nwokolo. Welcome to the program.
Dr. Nwokolo, good morning. Are you with us? Oh, yes. Good morning.
Yes, thank you, Adesto and Dr. Abati, for having me.
Yeah, good morning. Well, quickly, I would like to start with your assessment of how the Nigerian government, in the face of COVID-19, has been making provisions for persons in internally displaced persons camps across the Northeast in particular. I mean, we have a population of about 1.8 million persons in those IDPs. Will you say that government has paid enough attention to these isolated and displaced persons who will fall ordinarily among the most vulnerable in our society at this moment?
I think it's a very difficult situation to assess, but looking at it from a very face value, the question might even be, what was the position before COVID-19? If we are to go through that assumption that it was not really a very good situation, it means that COVID-19, let me use the word may have increase the vulnerability of the people in the IDP camps. So flip the situation to the other side, it will be very honest to say that the situation has deteriorated into a very not comfortable situation, considering that the resources are not really there, considering that even before COVID-19, there were a lot of struggles in those camps. Things were not really being, a lot of things were not being really done very well. So just like it has devastated the entire world, so one would be right to say it's not really Uhuru. We are really in a very poor situation.
Well, there was apprehension last month when an aid worker with Medicines Sans Frontières, that's Doctors Without Borders, was infected with coronavirus and later died. He had been said to have visited some camps, but governors across the region denied that he had no contact with anybody in the IDP camps. But my question is, how should we approach further? Because we do know that this aid needs to continue even at the time of COVID-19. So how should the humanitarian community and the aid workers who visit this camp approach? What should be the approach really? What sorts of measures should we put in place to ensure that this virus doesn't spread in the camps where social distancing or even hygiene measures are almost difficult to maintain?
As a social scientist, let me be a bit theoretical, but I'll try to explain as well. We as a people, as in sub-Saharan Africa, or let me come down home, Nigeria, we are struggling with the issue of ontology, epistemology, and methodology, which means we are struggling with our worldview, our perception, and the tools that we use in handling things. Sometimes we see data in front of us, but because we have pre-existing ideas about what we think should be done, we tend to discard our data. Sometimes our perception affects the way we reason that things should be done. Now, how can you be denying something that is in front of you? How can you be denying something that, is very obvious? what we are thinking is that by now, the governors of the Bay State, especially Bay States, Borno, Adamawa, and Yobe, should be doing a lot to engage not only the local NGOs, but the international NGOs on the best practices and the best way to do most of these things. For instance, take Maiduguri, for instance. Maiduguri has about 30 IDP camps, 17 formally organized camps and 13 informally organized camps, and with over 125 IDP people scattered all over Maiduguri. So one would be asking, have we sat down to look at the methodologies, the tools we are using, the perception we are doing, the local resilience strategy of the local people, which we think will fit into this difficult situation we are in? No, we've not thought of that. We've continued to do things the old way, thinking that we are going to get a new result. For instance, if you continue to give the people food voucher, which they go to the market to redeem, are you telling me that the tendency that they will contact coronavirus is not there? But if we decide to change the methodology by saying, okay, we're not going to give food vouchers again, we are going to take the food down to the people in the camp, put it 1 meter or 6 meter, after one another, so that you call them to come and pick it. Is that not a good method of handling it? Why do you keep denying something that you've not found a new way of trying to make it work? For instance, shouldn't the states, especially in the northeast states, shouldn't they by now be investing, repurposing their budget to put more money in health, more money in humanitarian intervention? Let them forget anything about training. For now, globally, what we are fighting is survival. Everybody is fighting survival. So these states should be fighting to survive. They should repurpose their budget towards humanitarian and health. They should forget about training and every other thing. So based on that, they should be investing more in PPE, to make sure that people who go to visit these people in the camp, especially people from the local NGOs, that they are well equipped to want to continue to do their job. Secondly, by this time, I think the Northeast Development Commission should be working with these states. There should be this synergy that brings everybody together. Okay, if you watch over the last 6 weeks, I've never had one jingle from National Orientation Agency. So if I cannot hear a jingle on the national TV, so how would I believe that they've been doing some community sensitization programs? How do I believe that they've been helping these states to try to find a way to demystify this myth that COVID-19 does not exist? Considering the level of poverty, which is very high in the north, which invariably includes the level of education, it means that a lot of people are not, even when they are aware, they continue to live in denial that it does not exist. So we know the issue of Kanu. Well, what happened in Kanu, or what is presently happening in Kanu, is the same thing. So the governors need to do more than denying that, they never visited the camps.
Yeah, certainly government needs to do a lot more for persons in the IDP camps. We also recall that before now, this year alone, we've had about 15 fire incidents in those IDP camps in the northeastern part of the country. But in terms of methodology, will you recommend that those IDP camps should be decongested? And what's your assessment of the quality of health facilities that are available in those IDP camps? What will you rate as priority? Because some of the things you said about taking food to them and all of that, yes, they make sense. But do we need to decongest those camps?
I think we need to do that as soon as possible, which might include looking at ideas like why we're trying to say we need to reintegrate these IDP internally displaced people back into their communities. There are some of them who already have been rejected by their communities. So we might start looking at some other ideas. Some other ideas like relocation. For instance, if you look at Maiduguri, if you walk into a typical camp, it's so clustered that like diseases like pandemics or diseases like COVID-19 or even Ebola or whatever, SARS or whatever, will be having a field day if we visit such a camp. So we should be looking at other methodology, which might include ideas like relocation. For instance, if there are communities in Boronu or if there are communities in Bauchi or Gombe where you think that you can build a camp, we can start thinking about, such idea, going to such communities, taking a sample survey, trying to examine, interview the people to see if they will accept other people being relocated to their communities. These states can come together and say, okay, we cannot continue to house these people in Maiduguri because it's not fit for purpose. We can decide to relocate them to other states in the northeast, build a camp, and then see whether they can begin to develop other sorts of livelihood and life goes on. But all these things cannot happen if we live in denial or if we decide not to sit down and think about it, do research and go out there to find a better way of putting our assumption into practice. I think that's the best way to go. We have to retool our methodology.
Indeed, and in 40 seconds, if you can, Dr. Nwokolo, you've talked about mitigating factors such as unawareness, denial, and poverty. But just how easy or difficult is the task for the governors to convince the people of the North with a historical background of skepticism towards global health measures? How easy or difficult a task is it for them?
We know it's a huge task. But if I'm the governor of any of the states now, what will I do? What I will do is that first, I will invest more money in sensitization. I will form a committee that is non-partisan, bringing out everybody that matters in my state. I will pull half of my civil servants, get them into the street and into the communities, making sure they have the right PPV, push them into the community to start doing this sensitization, forcing the lockdown and making sure that people adhere to
thank you very much.
To all the practices, washing hands and all that.
Thank you very much, Dr. Nwokolo. Thank you for joining us this morning.